All right. Good afternoon, everyone. Um, my name is Carrie, and I'm so glad to welcome you to our Farmy's USP 800 Preparedness Lunch and Learn today. It's crazy that we're halfway through this series, and whether it's your first time or your fifth time with us, we're so glad you're here. Um, so today we'll be discussing how to create and update a hazardous drug list. And it's an important topic as USP 800 compliance is vastly approaching. So the whole reason we created this series is to bring conversation, community around USP 800, because we know it can be a lot. And we're excited to share with you today our knowledge and our experience, and hopefully this can be a helpful resource to you. Throughout the webinar today, you'll note we'll have Q&A times. And if you ever have a question that comes up, just use your toolbar and type your question into the Q&A, and we'll make sure to answer that for you. And we'll also be doing some polls today. So whenever you see the polling questions pop up on the screen, please engage with them, and it'll help us get a better feel of how we can help you. So now I'll introduce our speakers for today. We have Miss Laura Paxton. She's the CEO of our Farmy with over 35 years of experience in the healthcare industry. And we also have Miss Shirlene Kristen, who's a customer experience specialist with our Farmy. And she spent 20 years as a certified pharmacy technician, and then she joined Team Our Farmy. So we're really excited to hear from both of you ladies today. And I'll pass it off to you, Laura.
Thank you, Carrie. And thank you all for being here with us today. We appreciate you spending your time with us. Just a recap of what's coming up for the next 3 weeks. Next week, we'll have safety information in the EHR, and that is going to be a webinar that has a lot of visuals, because we're actually going to show how our client base have integrated this information into their EHR, whether it's Meditech, Cerner, or Epic. You'll see pictures of how they've done that and what it looks like. Then we'll do when the inspectors come knocking. And finally, on May the 25th, we're going to do a wrap up. Now, remember that we've created a resource page for hazardous drug resources. You'll have an opportunity to scan a QR code at the end, and you'll have an opportunity to sign up for future webinars at the end. And let's get started. And we'll get started with a poll.
Thank you, Laura. So the first poll we have for you today is, have you included items on your hazardous drug list that are beyond the scope of NIOSH? So you should see the question appear on your screen now. If you would please answer yes or no. We'll give it just a few more seconds. Okay, thank you everyone for answering. I'm going to share the results now. And it looks like 60% of you said yes, and 40% said no. Thank you. Back to you, Laura.
Thank you, Carrie. So when we're thinking about a hazardous drug list and creating a hazardous drug list, I guess the first question we ask ourselves is, what should be on that? And the answer to that question is any drugs that are on the NIOSH list that may come into your organization's facilities or clinics need to be on the list, and any drugs on the market that meet any of the 6 characteristics of a hazardous drug. Now, we discussed those 6 characteristics of a hazardous drug last week, and if you need to refer back to that, you can look at the webinar from last week, or you can actually go to our resource page that, once again, you'll get a QR code to see at the end of this, but that's how you determine what needs to be on your list.
So first of all, let's talk about what's not on the NIOSH list, and what do we do with the things that we think are hazardous, but yet they're not on NIOSH. So new drugs, of course, NIOSH has always had some delay in time between newly approved drugs and the assessment by NIOSH. So also there are some drugs that are on the EPA and on the EPA list and not on the NIOSH list. So an organization's waste hauler is useful source of guidance about what is considered hazardous for disposal in your different jurisdictions. So you should be evaluating hazardous characteristics of the drugs that you are dispensing. Sometimes it's just about safety, and it may not be in black and white. It takes a group of people from the pharmaceutical buyer making the designated person or someone on the hazardous drug oversight committee aware that there has been a request to purchase a new drug, to a staff pharmacist alerting a patient has been admitted on a drug therapy that may be hazardous. So to all of you designated persons, make sure your staff is aware that you need to know. Now let's talk about the biologics that are not on the NIOSH list. So as many of you are aware, BCG is going to be removed according to the 2020 list. So NIOSH has removed drugs approved by the Center for Biologics Evaluation and Research, or the CBER, which includes things like BCG, botulinum toxins, and that type of, it's basically biologics, drugs that NIOSH does not consider, well, they're not drugs, items that NIOSH considers not drugs. So, however, these drugs still pose a risk. So you might want to consider keeping them on your HD list. You may even want to add an additional group for drugs like these.
Charlene, when you think about all of our clients who have completed their databases, what are we seeing our client base do with regard to BCG?
So as a general rule, for those clients that do have BCG on their, that do utilize BCG at their facilities, they're keeping it on the list because it still poses a risk to the healthcare workers. So, Carrie, let's ask our attendees what they think about BCG.
Thank you, Charlene. So our second poll for today is, if and when the NIOSH 2020 list becomes official, will BCG remain on your list? So you should see the question appear on your screen, and if you would please answer. I'll give it just a few more seconds. Okay, thank you, everyone. So it looks like 100% of you said it will remain on your list. Thank you. Back to you, Charlene.
Thanks, Carrie. That's great. 100%. Wow. I mean, that's what I would expect to see. So let's talk about the, I'm sorry, I scrolled up too far. So the NIOSH updates. So even though the 2016 list is somewhat outdated, NIOSH has continued to add or remove items from that list as recently as March of 2022. So there's also a link on our hazardous drugs resources page that goes directly to this information. So we will have a link to that via a QR code for you to scan towards the end of this webinar. Oh, next one. Yes. So I have to be honest, in 2016, my work life did not revolve around USP 800 or NIOSH. At the time, I was more involved in pharmacy informatics. I don't know exactly when the 2016 NIOSH list became official, but from what I can gather, it was sometime in 2017. Now, we've been hanging on the edge of our seats, waiting for 2020 to become official. And as of yet, it still does not have a release date. But anyway, we've been waiting for 3 years. So who knows if it will ever become the list, or if they will just scratch it and call it the 2023 or the 2024. That being said, this is what we're looking at for now. So as you know, 2016 is based on on 3 groups: anti-neoplastic, non-anti-neoplastic, and non-anti-neoplastics that pose reproductive risk. But the 2020 list is only 2 groups, or tables as they are now referred to. So table 1 meets the following classification criteria: drugs that contain manufacturer special handling information, and or drugs that meet the NIOSH definition of hazardous drug and are classified by the National Toxicology Program as known to be human carcinogen, and or classified by the International Agency for Research on Cancer as carcinogenic or probably carcinogenic. Many of these drugs are cytotoxic, and the majority are hazardous to males or females who are actively trying to conceive, women who are pregnant or may become pregnant, and women who are breastfeeding. So not all drugs in Table 1 are anti-neoplastic drugs, as NIOSH sees the term anti-neoplastic as no longer useful in understanding the hazards posed by individual drugs and has dropped that nomenclature from the HD list. Table 2 is all other. Basically, they meet the NIOSH definition of a hazardous drug, but are not drugs which have MSHI and are not classified by the NTP as known to be human carcinogen and or classified by the IARC as carcinogenic or probably carcinogenic. These drugs exhibit one or more of the types of toxicities described in the NIOSH definition of a hazardous drug. Some of these drugs present a hazard to males or females who are actively trying to conceive, women who are pregnant and may become pregnant, and women who are breastfeeding. Laura, do we have any questions?
Let me see. No, we don't have any questions.
Okay.
So for any of you who are listening, and you may have some questions that you come up with later, be sure and send us an email. You'll see our email addresses pop up in just a second. Recap, these are the upcoming webinars on May 11th, the EHR inspectors, and May 25th is the wrap up. And here is the QR code that you can scan to have access to our hazardous drug resource page. And there are Charlene's, mine and Charlene's email addresses. So if you come up with some questions later that you'd like to ask us, please send us an email. If there is something that you use that's not listed on that resource page, please let us know that as well. We're trying to create a comprehensive list that will be helpful for anyone that stumbles upon it. And finally, thanks to all of you for showing up today and spending this time with us. I hope you learned something valuable. I hope that you gained some knowledge here. Thank you to Carrie. Thank you to Charlene. And to all of you, I hope you have a wonderful rest of your day. Thanks so much. Bye-bye.
Thank you.